Healing fractures. This is one of our little clinical topics. Keeping in mind that what I'm going to show you here is healing, excuse me, of a fracture with really no complications. So, for instance, a compound fracture, you'd have soft tissue damage and the bone sticking out somewhere. You don't need to know what a compound fracture is. Just know the basic steps of healing that I'm going to show you. Also, I should just note, just for your own knowledge, depending on the patient itself, this healing process may not go well. So, for instance, elderly sometimes do not heal well from fractures. And I bet at least some of you have already worked with patients who break bones and have difficulties healing for any number of reasons. So, all we're going to do in this class is very simple fracture, clean break, and healthy patients. So what's the process that occurs when that happens? So it's the ideal situation if you're going to break a bone. Oh, by the way, this is important. You hopefully have already noted that bone has a really good blood supply. When we talked about things like their central canals and perforating canals, bringing the blood supply, and of course the spongy bone, some of it is just surrounded in marrow. So there is a lot of nutrients in bone tissue. So it heals really well, actually. And those of you who might have injured, say, a ligament or cartilage, know that they don't heal very well. They don't have a great blood supply. We've already talked about with cartilage. They do not have a good the chondrocytes do not have a good blood supply at all. It's very different in bone. So, yeah, bone spectacular stuff. Anyway, what happens? Okay, right after the break occurs, you get step one here, a hematoma forms. It's basically a blood clot. So, again, this is step one. You might want to note the 4 steps. When blood vessels tear, because there's lots of blood vessels in bone, you'll have bleeding and it'll collect there and clot. This is a really good thing, actually, because it will also bring white blood cells in case you have an infection. And it'll also attract macrophages that become osteoclasts. So this is the hematoma or blood clot stage. And those osteoclasts, you can see some bone debris here. So they will start cleaning up bone debris, and they'll have other white blood cells that will take care of infection. And also it's going to bring, I'm sorry, not osteoblast. That was a terrible mistake. Osteoclast. Yeah, where was I? Oh, it'll bring nutrients, the blood. You'll need all of that. Okay, so after a little while, and I do not expect you to have dates, but not dates, how many weeks into the injury we are, but pretty soon after that, after the initial break, you'll already start to form what's called a soft callus. And your book goes into a lot of detail about this step. I mean, the hematoma is not too much, but this step and other steps. All I really want you to know is ultimately chondroblasts are going to come along. And hopefully you're thinking, oh, cartilage. Well, it is written up there too. But chondroblasts will come and they'll build what we call a soft callus. And a soft callus is made of the strongest cartilage, the fibrocartilage. So fibrocartilage, hopefully you're thinking collagen. That's the type of fiber that is the strongest fiber in connective tissue. So there's lots of collagen in there, and you're going to hold the bones together there at the break. However, you could not put weight on it. Say if it was in your thigh or something like that. It's still soft enough and bendable enough that you would want to stay in a cast or somehow keep the bone, to keep the two broken ends from moving. Okay, then after this would be about 6 weeks with a healthy patient and a nice clean break. You get the hard callus or bony callus. Either one's fine. I realize actually, I think your book uses both terms, and that's totally fine. This is a rigid bone patch, so to speak. So the bony callus, of course, was made by What kind of cell? Osteoblasts are going to replace that cartilage and with different forms of, well, different orientation of collagen that will attract the minerals in your blood, and eventually you're going to get hard, rigid matrix. So then at this point, when you have a bony or hard callus, you can take the cast off and walk around. But you're not totally healed. This is really interesting. So in this last stage, which not really labeled on here, your book mentions it when it describes these stages. This last stage is bone remodeling, and it could take a while. You could be remodeling that bone for a year, depending on the size of the break and which parts of the bone, compact versus spongy, or broken. So let me go back just for a second to the bony callus that the osteoblasts have made. It is in a form that we call woven bone. What that means is that the collagen fibers that the osteoblasts lay down, they are in every direction. It's just a patch job, really. And so hopefully you recall from the previous video about bone remodeling that you want your collagen fibers and hence your osteons that are oriented inside, the collagen fibers are oriented inside. You want those to be in a place where they're going to carry the most weight. They're going to resist the greatest forces that you're placing on them. So when you start walking around again on your, let's say this is a femur, when you start walking around again on your femur with this, random orientation, that's not really ideal. So over the course of, depends on the break, but it could be like 6 months to a year. What's going to happen is that your osteoclasts, remember the bone destroyers, are going to come in and slowly eat away at the woven bone. And coming in right behind them is going to be osteoblasts that are going to reorient the bone to whatever direction takes force. Let's just say it's this direction is the direction that the most force is being placed on it, so you need the most support. So actually, it's really important to be walking during this stage or putting weight on the bone, whatever it may be, because that is going to stimulate the osteoblasts to orient it in a particular direction. If you're not using that bone, then the osteoblasts won't, quote, know, they don't really know, but they won't have a signal of any kind to know where to orient the bone, in which direction should you orient the bone. So this last process is really important because at this stage, it's not at full strength. It's patched, you can use it, but it isn't until after bone remodeling that it really gets to its fullest strength. And in fact, sometimes you'll see extra ridges in a bone on a skeleton. You can see where maybe somebody had a break before. Actually, radiologists can see it on an x-ray. They're really well trained to do that because you do tend to have a little bit of extra bone there. So in some ways, it's actually a little bit stronger after you break it, but still not something I would recommend. Anyway, so that's the basic steps of healing fractures. So you should know all 4 of those steps, and the description that I just gave is fine. I won't ask you for the level of detail that your book gives you.